Good afternoon, everyone, and welcome to our webinar on diabetes management, maintaining a healthy lifestyle. Are you at risk? So our presenter today is Keisha Lewis. So Ms. Lewis is a practicing occupational therapist and a certified diabetes care and education specialist with more than 17 years of experience working in the fields of human services, mental health, and physical disability. She serves as a consultant with the health programs for the National Caucus and Center on Black Aging. In 2019, Keisha co-founded Weldom LLC, an aging in place consultancy. Keisha's ultimate focus is empowering individuals with the skills they need to be independent in their environment without fear. Welcome, Keisha Lewis. Thank you once again for presenting with us. Welcome and thank you.
Thank you, Ms. Telesford. So today, as Ms. Telesford mentioned, we're going to be talking about maintaining a healthy lifestyle and learning more about diabetes and prediabetes. So November has actually been designated as National Diabetes Awareness Month. And this year, the focus was on prediabetes and identifying your risk of developing type 2 diabetes. So much of my presentation will focus on that and helping you to identify if you are at risk for diabetes and the steps that you need to take to prevent you from having diabetes. Now, if you currently have diabetes, we'll touch on some things that would be beneficial for you as well. So our objectives today are to identify diabetes and prediabetes, facts and figures, to differentiate between diabetes and prediabetes, identify risk factors associated with COVID-19 and diabetes, identify other risk factors, and identify means to reduce our risk. And lastly, we'll identify some resources that are available to us. So with diabetes statistics, over 34 million people actually have diabetes. And that's, when you think about it, and this data is from 2018. And so what I did not mention in here is nearly 1.6 million Americans have type 1 diabetes. And type 1 diabetes, that's including about 187,000 children and adolescents. When we look at the prevalence in our senior population, the percentage of those age 65 and older is about 26%, or 14.3 million seniors have diagnosed and undiagnosed diabetes. New cases of diabetes that we see, 1.5 million Americans are diagnosed with diabetes every year. And then that last bullet that we see there is that 88 million people actually have pre-diabetes. And that is Americans age 18 and older. So some of those statistics I would say are astounding for the amount of people that we see that actually have diabetes and pre-diabetes. So with that 88 million people, our focus is on how do we prevent this? So when we think about prediabetes, prediabetes is a condition in which individuals have blood sugar levels that are higher than what's considered normal, but lower than the levels considered to have diabetes. And prediabetes increases the risk of developing type 2 diabetes later in life, as well as the risk of developing heart disease. So we often see that people who have prediabetes, they have a 50% chance of developing diabetes within 5 to 10 years. So the CDC, they actually have a great tool through the National Diabetes Prevention Program. And it's a little checklist so you can see, could you have prediabetes? So you can actually take this risk test. And this is the CDC's website, the National Diabetes and Prevention Program. I'm going to ask you a series of about 7 questions. They're pretty easy to answer, but it helps you to identify your risk of developing prediabetes. So the link is at the bottom there, but if you go to the cdc.gov diabetes prevention, prediabetes risk test, you can find that link. I'll also share one with you in a little bit from the American Diabetes Association as well. So when we think of, okay, we talked about prediabetes, now we're going to talk about diabetes. So diabetes is a disease in which the body does not make enough insulin or properly use the insulin that it does make. Insulin is just simply a hormone that's needed to turn sugar and starches and other food into energy needed for daily life. So that's the textbook definition of what diabetes is. So when we look at diabetes and COVID-19, and I know we've been talking about COVID-19 a lot lately, but COVID-19 has been with us for the last 19 months or so. And it's important to know and understand that people that have diabetes are more at risk. And so what we see is in general that people with diabetes are more likely to have more severe symptoms and complications if they were affected with COVID-19 or any virus. So what we've also seen is of those that have died from COVID-19, 40% were living with diabetes. So 40% had that pre-existing condition that put them at risk. And we also see that people with diabetes are more likely to have those serious complications related from COVID-19. And lastly, I'll mention here is that underlying health conditions, including diabetes, put you at risk for developing COVID-19 or any other virus. So with having diabetes, being at risk for diabetes, if you do develop COVID-19, it may take you longer to recover and bounce back from that. Now, some of the risk factors we see for prediabetes and diabetes, and you'll notice these are the things that put us at risk. You look at this list and you say to self, hey, do I fit in one of these categories? But being overweight, having abdominal obesity for circumference in men greater than 40 and women greater than 35. So increased belly fat will put us at risk for diabetes. Physical inactivity. So ask yourself, do I exercise? Do I get enough exercise? If not, you're at risk for developing prediabetes or diabetes. Smoking. Do you have a history of smoking? Are you over the age of 45? Is there a strong family history? So genetics, we're predisposed to something from our family. And then we see certain ethnic groups. So African American, Hispanic, Latino, the Latinx community, Native Americans, Asian American, and Pacific Islanders are all at a greater risk for developing type 2 diabetes and prediabetes. And then women that have experienced gestational diabetes. So that's diabetes that develops when a woman is pregnant due to a hormonal imbalance. Those women are also more at risk for later developing type 2 diabetes. And you also see there, if you are a woman and you delivered a baby weighing more than 9 pounds, you're at more risk for type 2 diabetes or prediabetes later in life. And then those that have abnormal cholesterol and blood pressure numbers are more at risk for developing prediabetes and type 2 diabetes. And when you think about what is a normal blood pressure, so a healthy blood pressure is defined as a blood pressure that's 120 over 80. We get into an elevated blood pressure when that top number goes between 120 and 129. And then we have stage 1 hypertension when that top number ranges between 130 and 139. And that bottom number for the blood pressure ranges between 80 and 89. So next you'll see is there is a link that I provided as another resource here on the American Diabetes Association website, diabetes.org. It's also a diabetes risk and tool assessment that you can do. It takes less than 60 minutes, I would say. But what it is the question. It takes you through, if you go to the link, are you at risk, or is there a loved one maybe you want to see is at risk of diabetes? And it's about 8 questions, I believe, as well. At the top of this, you'll notice there are some places in your community where you can go and you can actually get tested for diabetes. So you can get a blood sugar test, an A1C test, or just a health screening at your local Walmart. And if you go on the American Diabetes Association website, you can actually find a Walmart where you can actually go in your specific location. And then CVS, many of the CVSs have a clinic and you can get your blood sugar and your A1C tested or a health screen done through CVS. So there's the link there if you are interested in using that resource. So if you develop prediabetes or diabetes, what happens when the glucose can't get into your cells to be used for energy? So it builds up to harmful levels in your bloodstream. And that's why you have high glucose or diabetes, is because that extra glucose that's in your bloodstream, it can't get out of your body. Okay. And so over time, that harmful amount of sugar that's in your bloodstream, it can cause damage to your organs, your nerves, and the vessels in your body. So when diabetes is left untreated or your numbers are elevated for extended periods of time, diabetes can cause complications that can affect every part of your body. And so we stress this point so that we can point out that diabetes complications, they aren't inevitable, but instead we want you to know that diabetes complications can be avoided if when you find out you have diabetes or prediabetes, you take the steps to avoid these complications and manage your glucose levels. So on this next slide, we see that uncontrolled diabetes, it can affect your eyes, your cardiovascular system, your nerves, your kidneys, your sexual function, as well as your feet. But what I want you to remember are these things are not inevitable. They do not have to happen. I often tell the patients that I see in an outpatient clinic is that, before you come to see me, you didn't know you had diabetes. So you couldn't do anything about it. But now that you're here, you have diabetes, you're going to learn to manage that. Or now you have prediabetes, we're going to learn to manage that, and you're going to be okay. And that's one thing that I do want people to remember, because sometimes we have bad memories, or we hear bad stories from people that we know that have had diabetes. And more than likely it's due to the uncontrolled diabetes. And so you can control it and you can manage it. So for those of you asking the question here, well, how do I know if I have diabetes? How do I know if I have prediabetes? So these numbers are just letting you know how is diabetes diagnosed. I will note here, these aren't the numbers that I want you to maintain if you have diabetes, but these are how do you know and how is diabetes diagnosed? So someone that has a healthy glucose, they don't have diabetes. Their healthy fasting glucose is less than 100, okay? And then 2 hours after that individual would eat a meal, their blood sugars would be less than 140. Now, when you're in the range of prediabetes, that means you went to the doctor, you did a some fasting blood work, and your glucose levels would be between 100 and 125. And that's indicative of prediabetes, or they might tell you have impaired glucose. And then if I were to take a test with that individual 2 hours after they ate a meal, their blood sugars would be between 140 and 199. Then we reach that category of diabetes. So diabetes is when your fasting blood sugar goes above 126, or you have a hemoglobin A1C of 6.5%. And then diabetes is also indicated when you just do a random fasting test, or random test, and that number is over 200, then that tells us you have diabetes. And so these are how diabetes is diagnosed. I didn't mention in my previous slides, I think, about the hemoglobin A1C, but what I want you to know about that test, because you see there, if you've been diagnosed with diabetes, it's over 126, or the A1C is 6.5 or greater. But that hemoglobin A1C is a test that looks at what your blood sugars, or how your blood sugars have been over a 90-day period of time. So our red blood cells in our body, they recycle themselves every 90 days. So over the past 90 days, if my blood sugars have been elevated, that hemoglobin A1C test is going to show up and be elevated. And so once it reaches above 6.5, that indicates that I have diabetes. So what are some of the symptoms you might be experiencing if you have diabetes? Some of the symptoms there are frequent urination, and that's just our body's response trying to get rid of that excess sugar. Unusual thirst, extreme hunger, extreme fatigue. We get that extreme fatigue because our body naturally uses sugar for energy. But when our blood sugars are high and the insulin in our body that we're producing is not producing as it should, then the sugar can't get into our bloodstreams to be used, or the sugar can't get into our muscle cells to be used for energy because it's all stuck in our bloodstream. So what happens is we get tired, okay, because we're not using that sugar properly for energy. And then blurred vision. You might experience blurred vision because the diabetes or the high blood sugars have started to affect the tiny vessels in your eye. And then if you notice that you have cuts or bruises that are slow to heal, that could also be a sign that you have diabetes. So if you have pre-diabetes, well, you have diabetes, okay? The progression is not inevitable. So because you have pre-diabetes, it doesn't always mean you're gonna go to diabetes. But you see their diet and physical activity can help restore normal blood sugar levels. There was a study that was conducted called the Diabetes Prevention Program. And what it showed was that through lifestyle changes and interventions, people that were at high risk for diabetes reduced developing diabetes by at least 58% during a 3-year period. And then we saw that the reduction was even greater among those that were age 60 and older. So now the CDC actually does a program. It's called the DPP program, the Diabetes Prevention Program. And you can even go on the CDC's website. So if you are at risk for diabetes and you're in that pre-diabetes category, that you actually can enroll and participate in the diabetes prevention classes. And maybe you can find one in your local area if that is something that interests you. So when we look at managing diabetes, so managing your diabetes, I like to say, I can't say it's simple, but we have tools to manage it. And with those tools, you can be successful. So it involves healthy eating, making sure you monitor your blood sugars. If the doctor has prescribed medication for you, making sure that you take that medication, increasing your physical activity level, and then receiving diabetes education. So I have on my slide there that knowledge is power, and that's very, very important. The other thing I'd like to say is sometimes with managing diabetes, medication is not always needed, but if it is, we do want you to take it. Some people may even need insulin someday to help them manage their diabetes. And I always like to tell people, if you go from an oral medication to maybe insulin, that doesn't mean you failed, okay? That just means that your body is no longer able to produce enough insulin to process the glucose and keep it in a controlled range. So that doesn't mean you failed. It just means that, hey, our body is changing. I always like to think of our body as a car. You have a car that's a later model and stuff starts to break down on it. And so sometimes that happens to our body. But what we need to know is, hey, we can manage this and we can work on this. So now we'll talk about some of the necessary lifestyle changes in order to manage this. So what we see is that a 5 to 7% weight loss, and if you're overweight, that is, it's necessary, okay, to change some of those lifestyle. An example here is if you weigh 200 pounds and you lose 10 pounds, that's going to positively impact your health. Another thing that we say is you perform 30 minutes of moderate, intense physical activity 5 or more days of the week. And you need to work on making better food choices. We'll talk a little bit more about physical activity as well as food choices in the next couple of slides. But this is pretty much what it takes for those necessary lifestyle changes. So what I want to tell you first of all about physical activity is always check with your doctor first. If you have not been active, I don't want you to say, Keisha told me to out there, named Keisha, let me say that. A girl named Keisha, who's diabetes educator, told me to go out there and start exercising. No. Physical activity, I want you to check with your doctor and see if your doctor clears you or says that that's a good idea for you, okay? I gotta make sure that your heart is healthy. So you check with your doctor. If you're sedentary, just start by walking, okay? You don't have to join a gym. You don't have to spend money on fancy programs, just walk, okay? And if you're already active, then choose to exercise more frequently or increase the time. So now if you walk 2 days a week, say, oh, you know what, I'm gonna increase that to 3 or 4 days a week. Physical activity can lower your blood pressure. Excuse me, I got ahead of myself, but physical activity can lower your blood sugar, okay? Because what it's gonna do for your blood sugar is gonna open up the cells and it's gonna allow that sugar to go in a little bit quicker. But physical activity will actually lower your blood pressure. And I focused on blood pressure today, but I do wanna say that, okay? And then the goal is to exercise 30 minutes on most days. And so I always tell people, you know, try to engage in group activity. Group activity is fun. If you have someone that can be an accountability partner for you so you can increase your physical activity, that would be great. The other thing you can do is when we exercise, like I was saying, the cells begin to open up and the cells open up. And so our body doesn't need to use insulin as much because we're burning that extra sugar that's in our bloodstream by exercising. I also tell people with that 30 minutes of physical activity, if you cannot get 30 minutes all at once, you eat breakfast, lunch, and dinner. Most of us eat about 3 meals a day. So if you would consider taking a walk after breakfast, lunch, or dinner, you would have 30 minutes over the course of the day. That would be 5 days a week because we all eat at least 7 days a week. But if you could commit to 5 days a week and you do that 10 minutes after each meal, that would actually be great. And then you can gradually build up over time. So maybe you can walk for 30 minutes straight. So start small with that 10 minutes of walking and build upon that. Other tips on being active is you want to work towards that 150 minutes a week. So that's 30 minutes 5 times a day, 5 times a week. You want to start slow and you want to build up on it. Maybe walking isn't for you, so you decide you want to find an activity that's fun, that you enjoy. It could be biking, dancing, tennis, playing golf, or Zumba. You know, we could invite a friend and go dance and Zumba. And then also, like I said earlier, is being active with a friend or family member. Sometimes that can motivate us to stay active. We can add strength training, weights, resistive bands. We can do planks or push-ups to help us work on building strength. And remember here that doing something is better than doing nothing. So if you only do the 10 minutes and you commit to that 3 times a day and it's only walking, then that's perfectly fine. And then when we focus on, okay, how do we lose weight or what do we need to do to lose weight? I always say that small steps, it takes small steps to lose weight. We don't have to do everything all at once. So weight loss is all about balance. So once the weight goal is met, you will need enough food and enough physical activity to maintain it. So cutting out 200 to 300 calories from food and burning 200 to 300 calories with exercise every day can contribute to a weight loss of about 2 to 4 pounds a month. So you see that scale that I have there? So too much food and not enough activity is going to equal weight gain. Less food and more activity is going to equal weight loss. So it's about definitely a balance. So next we're going to focus on, okay, how can we improve our diet? Okay, and I don't mean getting on a diet. I mean, how can we improve the way we eat? One thing we can do is consume less calories. We can lower our fat intake. We can consume a moderate amount of carbohydrates. We can choose a diet that's higher in fiber that's going to be good for our digestion. And then you can consult with a registered dietitian. So general guidelines and things that you need to remember about controlling your blood sugars, your blood glucose. Okay, so when we eat, the timing of meals is important. What we eat, so the types of food we eat, and then how much are we eating. So when we look at the timing of meals, you want to avoid skipping meals. Eat 3 meals and spread them out over the day. Now that is the recommendations for good management of blood glucose. Now I do know that there is something that many of us do now called intermittent fasting. I need to learn a little bit more about that intermittent fasting. However, for good glucose management and control, when you have diabetes or pre-diabetes, we do want to avoid skipping those meals because eating at a consistent time will help your blood sugars remain stable so that we don't get highs and then lows. You also maybe want to have a snack if you're going longer than 5 hours without food. You want to look at spreading your carbohydrates out over all of your meals. So you don't want to sit and have all of your carbohydrates at breakfast or all of them at dinner. And then be cautious about late night snacking. So let's talk about what our foods are made of so we actually know. So we have 2 types of nutrients. So we have your macronutrients and then your micronutrients. So your macronutrients are those things like your carbohydrates, your protein, your fat, okay, the larger nutrients. Then we have the micronutrients, which are your vitamins and your minerals. And then we have carbohydrates. So carbohydrates, these are the sugars, starches, and fiber in our food. And starch is a chain of a sugar molecule. And all starch, all carbohydrates are broken down into sugar. So we need carbohydrates though, because carbohydrates are the body's main source of energy. And then as much as 100% of the carbohydrates we do eat, they're changed into glucose, okay? So just know that carbohydrates, they do affect the blood sugar. Okay, they're going to have the most impact on the blood sugar. But again, because carbohydrates provide us energy, we can't simply cut them all out. So then we have protein. So protein, we need it because it's going to help our body build and repair muscle, skin, and every cell in our body. And proteins are going to be found primarily in your meat, your dairy, and some plant-based foods will also have some proteins. But protein does not directly affect your blood sugars. Then we have fat. So fat is definitely an essential nutrient because it does supply us calories and it carries the fat soluble vitamins like vitamin A, D, E, and K. But fat, it contributes to flavor, which when we eat, we want to enjoy our food. So it contributes to flavor, the texture in food, and it helps us to have that feeling of fullness. But fat does not affect our blood sugar, but fat is high in calories. So we can't have endless amounts of fat either. So our food groups, when we look at, okay, what are our food groups when we're eating and we're breaking this down? So foods are grouped together based on similar nutrients. So what we see here is you have your starches and your starchy vegetables, your fruit, your milk, and your yogurt, your non-starchy vegetables, your proteins, and then your fats. Our foods that are highest in carbohydrates are your starches and your starchy vegetables. And so your starches are like your bread, your rice, your pasta, your cereal. Your starchy vegetables are your potato, your corn, your beans, your peas, your lentils. Those are your starchy vegetables. Then you have fruit. So any type of fruit has carbohydrates. And then you have your milk and your yogurt. So I know there's dairy-free milks now. You have like your oat milk and your almond milk, but you'll have to look at the label because some of those contain carbohydrates as well. So when we get down to portion control and how we should be eating and what our plate should look like. So the recommendation is that for women, you have 3 to 4 servings of carbohydrate per meal, okay? And 1 serving of carbohydrate for a snack. Okay, and we'll talk about what that looks like next. In men, we say 4 to 5 servings of carbohydrate per meal and 1 to 2 servings of carbohydrate for a snack. So what does that look like and how we build a healthy plate? So I always tell people, devote more of your plate to your non-starchy vegetables. So your broccoli, your asparagus, your salad. And then you want to reduce portions for starches. So you want to reduce what you eat of the rice, the pasta, the potatoes, the bread. And then you want to choose various amounts of lean protein, whether that be chicken, fish, pork, or turkey. And then you want to go easy on creamy sauces or creamy dressings that add in that extra fat and calories. So in 2 slides back, I mentioned that our serving size for women is 3 to 4 servings of carbohydrate. And for men, that would be 4 to 5 servings. So this is a method that we call the plate guide method, in which we look at about a 9-inch plate and we say, what should our plate look like? So what you see there is that half of your plate should consist of those non-starchy vegetables. A quarter of your plate is going to be a lean protein, and then the other quarter of your plate is going to be a starch or a grain. So in this particular picture, that serving size of that starch there is probably about, I don't know, that might be a little over a third of a cup. But a third of a cup of the starch is considered as 1 serving. And so we added a second little third of a cup of rice. That would then be 2 servings, okay? But this just gives you an idea of, if this were your plate, what it would look like. And vegetables, I want you to focus on. Those non-starchy vegetables are going to fill half of your plate. Other things that you can do, I know that we're all busy. We live a fast-paced life. Stuff isn't always easy because we're taking care of a lot of other responsibilities. But something that you can do to help you out is to do some meal planning. And so we'll talk about some meal planning tips, because it's easier if you can plan out your meals for the week. So you can just go in the refrigerator, pull something out and eat it. Use time savers like pre-chopped or frozen vegetables. I always say the freezer is your friend. You can make stuff on the weekend and freeze it so you can go back to it. You can make double batches of food. Like I recently made chili, vegetable-based chili without beans, and I made double batches of it. And when you meal plan and you prepare in advance, it helps you to make healthier choices. So when it's crunch time, you don't go to the local fast food restaurant and eat. Something else that you can do is think about, how can I reduce my calories? So I'll encourage people, try to keep a food journal for 2 to 3 days, and then go back and look at it and identify what's the extras that you're eating. Okay, as well as what foods you're eating are very high in fat or sugar. And oftentimes we don't know what we're eating because we think, oh, we're doing okay. I'm eating pretty good. But when you actually write it down and go back and look at it, you see, well, maybe I could have changed a few things. Write down what and how much you're eating. Take a red pen at the end of those 2 to 3 days and circle all the things that are the extras and all of the things that are high fat or high sugar foods. And then you for yourself have to decide what you're willing to change. I always tell my patients, this is a team approach. I can only give you the tools. You have to take that information and you have to make the decisions, because I can't be with you all the time. So you have to think about, what am I willing to change? So what is the extra in food? Okay, so we really get to it, and this helps us understand what is the extra. So my example here is that juice is made up of 100% fruit and it's very high in sugar. So a lot of times we think we're getting 100% orange juice and that's good for us, okay? But if you turn that juice over and you look at that label and you dissect it, you'll learn differently. So a cup of juice has almost the same amount of sugar as 1 cup of soda, okay? And that's about 7 teaspoons. So if you took a cup of water and you took a teaspoon and you started pouring 7 teaspoons of sugar in that cup of water, you probably wouldn't drink it. So you would need about 3 to 4 oranges, fresh oranges, to make 1 cup of juice. Drinking 1 cup of juice, you can consume the sugar of 3 to 4 oranges within a few minutes. So commonly for my patients that have diabetes or that have prediabetes, I will encourage them to stay away from juice because that is simply drinking all of your calories, drinking all of your carbohydrates, and I would rather have more food. But if you have to have juice or the taste of juice, I encourage you to choose a whole piece of fruit, okay? Because that piece of fruit will help you obtain your vitamins and minerals and give you fiber. And that's much better than that cup of juice. And if you are going to have juice, you want to limit it to about a half a cup of juice. And I know that doesn't seem like much, but that's what I want you to limit it to because you're avoiding all of that extra sugar. Okay, so that's what we mean when we say, what is the extra? What can I do with that? Other resources for you, you'll see here is that we actually, if you have diabetes or pre-diabetes, there's a lot of interesting apps out there that you can refer to or you can use to help you on your journey. So these are just a few of them. There's a whole bunch out there. I just put a few here that I like. There's a book called The Calorie King. It's a calorie, fat, and carbohydrate counter, and it has fast food chains. So those of you that may not cook and you enjoy going to a chain fast food restaurant, it will help you make better decisions or informed decisions, I'll say. Then you have MyFitnessPal. It is a food and exercise app. You can track and monitor your calories with that. And then there's an app called Lose It. If weight loss is your focus and your goal, it keeps a count of what you're consuming, your calories. You can log your meals. It's a diary. And then that last little app down there in the bottom right-hand corner is it's an app called Figwe. And I like that particular one as well, because it gives you an idea of you counting calories or counting carbohydrates. You can actually take a picture of your food and it will kind of give you a breakdown of how many carbs or calories it thinks it is. Or you can pick a food, like in this picture, it was grapes, and you have the ability to increase the amount or decrease the amount, and it will kind of tell you based on what you said is on your plate, this is the amount of carbohydrates you have, or this is the amount of calories you have. So there are various apps to help you in this journey with managing diabetes and pre-diabetes. So reducing your risk for developing pre-diabetes or diabetes, definitely possible. And reducing those risks, again, include exercise, portion control, lowering your blood pressure and your cholesterol if you know that that is concerned. Taking medications as needed. And I want you to remember that diabetes complications are not inevitable. These things do not have to happen because you can manage it. Pre-diabetes and diabetes can successfully be managed through monitoring blood sugars, healthy eating, physical activity, medication, and weight loss. These are all things that play a role. And then this is just, again, the campaign for National Diabetes Month 2021. It's small steps make a big difference. And so these are some of the things I definitely tried to highlight today in my presentation, was that taking small steps, so making changes through your lifestyle, being more physically active there. And it talks about the 30 minutes of physical activity 5 days a week. Choosing healthier food options and drinks most of the time, losing weight, tracking that weight loss and keeping it off, seeking support from your doctor. If you've been diagnosed with pre-diabetes or diabetes and you've never seen a dietitian or you never participated in diabetes education classes, call your doctor, ask for a referral to an outpatient program or an outpatient dietitian to help you on your journey. And then stay up to date on vaccinations. So definitely now COVID-19 vaccine is one that I want you to stay up to date with, but also your flu vaccine. That's important too, because having diabetes, if you get the flu, you're going to have a harder time recovering. So that's important. And this tool and other tools can actually be found on the National Institute of Diabetes and Digestive and Kidney Disease website. And I have the link there, niddk.nih.gov. And then the next couple of slides, and I'm going to be finishing up so I can take some questions, but these are resources for prevention. So diabetes and nutrition counseling is available, and it's usually covered by your health insurance. If you have Medicare, Medicare will cover individual counseling as well as they cover actually 10 hours of diabetes education. So that usually includes 1 to 2 hours of individual counseling and then group education classes. So if you're interested in that, find out about what's your local resources for that. Your local hospital probably has a class that you can attend. Also, the CDC Diabetes and Prevention Program, if you use that link, you can go on there and you can see what is being offered in your local area. The American Diabetes Association has a wealth of knowledge about what is available to you. And then I also included my business down there is Live Weldom or Weldom LLC. Because we can not only help you with wellness and management, but also helping you to age safely and stay in your home. And you can find us on the web as well. And the references that I used today was from the American Diabetes Association, the Center for Disease Control and their National Diabetes and Statistics Report, Google Images, and then I used some images from freepic.com. So now it's about 1:41, so I think I have some time for some questions. And I see some stuff in the chat, but Ms. T, you might be able to help me out with facilitating that.
I shall. So thank you so kindly, Keisha. Always great information. We appreciate you. So in the chat, we had a question of, do we need insurance for A1C, for getting our A1C test at Walmart or CVS? And do they take Medicare or Medicaid?
So, Ms. T, is a covered benefit. You would need insurance to have that covered. So yes, CVS and Walmart, I do believe they take Medicare. I know they take Medicare, and they may take Medicaid. I can't be 100% sure about Medicaid, but I do know, depending on where you are in Virginia, Maryland, or DC, in our local area where I am, there's a lot of health clinics that you can go to if you have Medicaid that can provide the testing for you. But use your insurance benefit if you have that to go get the A1C test done. Also, if you have your primary care doctor, you can go to your primary care physician and use your insurance benefit when you do your annual exam to get your blood levels or your blood work done. And you can find out and ask your doctor, hey, can I have an A1C test? Can I have fasting blood work done? So you'll know what your numbers are.
Thank you. Please, everyone, if you have a question, please put it in the chat, and we'll be happy to ask that given the time. So our next question, Keisha, is Thanksgiving is a few weeks away. What can I eat? I want to enjoy everything.
Okay, so you're right. Thanksgiving is a few weeks away. Then after Thanksgiving, there's always goodies in the store because it's just that time of year. So you have to think about it. And I always tell people, I like to eat too. Y'all might can tell my neck looks a little small, so I might be a little thin, but I do like to eat. So it's important for me to space everything out. So you can't have everything all at once, because Thanksgiving meals, big family meals are usually a lot of carbs. So it's really important that you space that out. So if I, mentioned earlier, you can have 2 to 3 servings of carbs per meal. You have to think about, what can I have? So I always tell my patients, for me, it's only a couple times a year that I eat sweet potato pie. And Thanksgiving or Christmas is one of them. So I might just choose, which I'm not saying is the healthiest, but Thanksgiving and other holidays, only whatever you celebrate, only comes around once a year. So I might choose to have some coffee and a piece of sweet potato pie for my breakfast. Now, that's not the healthiest thing, but what I do know is I cannot sit there for dinner and have all of what I want for dinner and then have sweet potato pie. I'm going to be way over on what I need. So my breakfast, it very well might be sweet potato pie and coffee. And then my lunch might be a little taste of some mashed potatoes and maybe a little taste of some dressing. And then maybe I have my protein is turkey. But then it stops there. And everything else is a non-starchy vegetable, whether it is some greens or whether it is some green beans. And that's what I'm going to fill up on. So you have to spread the love, but you can still enjoy those foods that you like. It's just about the serving size and the amount that you eat.
Okay. One of the other questions is, does poor dental health contribute to diabetes?
So, yes, it can. And I guess I should say that diabetes, uncontrolled diabetes, can contribute to poor dental health. So, I once had a physician tell me at a lecture that diabetes was the mother of all illnesses. And now I tell people uncontrolled diabetes is the mother of all illnesses, because diabetes will affect every part of your body. So if your blood sugars are not properly controlled, they stay elevated. Diabetes can have an impact on your teeth, your gum health. And sometimes if you go to the dentist, they may ask you if you have diabetes. But again, those are those tiny vessels that go to your gums. And so definitely with uncontrolled diabetes, you might notice some problems with your gum and your teeth, the health of your teeth. But managing those blood sugars can actually prevent gum disease and tooth decay.
Yes. So one of the other questions is, Keisha, is there a link between diabetes and the brain? You did mention that everything, the body.
Yeah, so diabetes, it can affect every part of your body. And so with that, your brain, you have what we call we have complications that affect small vessels, and those are called microvascular complications. And then we have complications that affect large blood vessels, and those are called macrovascular. And so the macrovascular, or the large blood vessels, are the vessels that go to your brain and to your heart. And so if your blood sugars are elevated over a long period of time and your blood is not properly flowing to your heart or to your brain, then you could experience some of those effects, and it could lead to heart disease, or it could lead to stroke. So it could impact your brain health, because I always tell people when your blood sugars are high, and the only way I can think of this is if everybody knows what Karo syrup is. So if we color that Karo syrup and we made it red, okay, that Karo syrup would be like our blood flowing through our very tiny vessels or our very large vessels, okay? Our blood wasn't designed to flow in such a manner. Our blood is designed to flow seamless. So if your blood sugars are elevated over time, you have that Karo syrup, that thick, sticky substance moving through our body. Okay, our blood doesn't flow as it should. And so sometimes that puts our blood at risk for clotting. It puts our blood at risk for decreased oxygen flow that reaches our heart or our brain. And so over time, that will cause some damage.
Okay. Oh my. Important to take care of ourselves. One next question on the chat is, what about sugar-free juices? You mentioned about drinking a lot of juices, how sweet it is. And can I have that sugar-free juice? Can I have that? That's the question.
Right. So if there's a sugar-free option and you can't, just give up juice totally, a sugar-free option could be an option. But when you look at the back, sometimes if it says that it's sugar-free, you want to turn the label over. And I did not put a label in my slide presentation, but you want to make sure that not only does it say that it's sugar-free, but when you turn that back of that label over, you want to make sure that it doesn't have any carbohydrates in it. And sometimes the sugar content is broken down in the list of carbohydrates. And so you want to make sure that it says 0 carbs, as well as 0 sugar. And that is an option. My experience has been sometimes people don't like the taste of what is a sugar-free beverage, but it's a good transition if you can't completely give up juice or you can't completely give up soda. Other things that some people like to do is, example would be, and I call them the shake packs because I don't necessarily give a brand name, but there are certain little packets of beverage flavors, and you can put them in water. So there's different ones that flavor it lemonade or grape or fruit punch, and those are 0 calorie, 0 carbs, 0 sugars. So that's an option for people to use as well if they're looking for something that's flavored.
Great, great, great. Do I need to wear a diabetes bracelet? Also in the chat.
So if you have diabetes, and I always tell people if you're at risk for having low blood sugars, wearing a diabetes bracelet is not a bad idea. Because if something were to happen, your blood sugars were to go low, you were to become incoherent, it would be nice for someone to know that you do have diabetes or any other medical condition that you have. If you're on blood thinners, if you have a seizure disorder, all of that would be good to have on a medical alert bracelet. But if low blood sugars is not really a problem for you, maybe a diabetes bracelet is not something that you need right now. But I would recommend that if you have multiple health problems.
Okay, so can I reverse diabetes?
Okay, so that's a good question too, and I always hear that. And oftentimes, I think we watch or we see shows on TV that says, oh, person had diabetes, they lost a lot of weight, they no longer have it, or we hear commercials on TV. And so my answer to that is what you can do with diabetes is you can manage it. So you can't really reverse it. And this is the reason why. People make lifestyle changes that impact their blood sugars. So if I go on a TV show and I have a chef cook for me and I'm eating a certain way, and I go out there and I exercise 5 days a week for 2 or more hours, and I have someone standing over me and coaching me about what I need to do, my blood sugars are going to drop. The numbers are going to drop, the blood glucose numbers, the A1C number, the blood pressure, the cholesterol, all of that's going to drop and it's going to return to a normal level because I am doing something actively to maintain and manage that. But if I go back to the same habit of eating the same way, not exercising, not having that chef, not having that coach, my numbers are going to go back up. So you didn't reverse it. What you simply did was what we're talking about today is you managed it. You managed it so it was in control. So that's what we do with diabetes is we manage diabetes. And if you manage it for 5 or 10 years in the same way, your numbers may not go up and you may not need medication. But if you make any simple change, sometimes those numbers are going to start to creep back up.
Yeah, okay. Oh, great answers. How can I lower my blood glucose level quickly?
Well, I always say I wish it was a way or a magic pill, but it really isn't. And so when I tell people, they say, is diabetes easy to manage? I have some people that might say yes. I have some people that say no. I'm probably on the fence or walking the little line. Because it's about lifestyle change. So changing your lifestyle, you're going to have a positive impact and you're going to change things. If you don't, then you're going to have a negative impact and your numbers are going to go up. So it's not really a quick way. It takes some time because we're adults and we can't change everything all at once. So we have to think about what do we want to choose? Do we want to try to incorporate walking? That's going to help us. Are we going to try to, decrease the amount of carbohydrates we eat? And that's going to help us. So it's a team effort, but it takes a lot of different tools and it's not going to happen overnight. It takes some time.
How important is sleep when managing diabetes?
Okay, so sleep is very important factor. We read a lot about sleep. When we don't get enough sleep, decrease sleep has the ability to affect and change some of the hormones in our body. And that those hormonal changes can cause an increase in our blood sugars. So people that don't get enough sleep, they are more at risk for higher blood sugars. People that have different sleep disorders, like if you have sleep apnea, you're at more risk for having higher blood sugars because you're not sleeping at night. When you're not sleeping at night, I think cortisol levels rise in our body, and cortisol is a stress hormone, and it can actually cause us to have elevated blood sugars. So yes, sleep is important. We need to get that recommended, what do they say, 6 to 8 hours of sleep. And that can definitely help us to manage our blood sugars better. And we might see a change in our blood sugars.
One more question. How can I help? My spouse loves sweets. So how can I help him stop eating so much junk food?
You know, that's a hard one because what I have learned, Ms. Telesford, is that people have to be at a point where they want to change. Now, the best way to help your spouse who loves sweets is don't buy the sweets. But if your spouse goes out and buys the sweets, then you can't help that because you're not with your spouse all the time. So you change your behaviors, have your spouse see the difference in you and the changes you have made. You try to make things at home that are sweets that your spouse might like, but they're different types of sweets. And so maybe they get used to them, but each individual has to be at a point where they're ready to change their behavior. If they aren't ready to change their behavior, what you do in the house, you can control, but once they go outside of the house, you can't control that. So what you can do is you can encourage it and you can emulate the behavior, what you're doing, and then maybe that might rub off. My experience has been, it won't. But that's a help, okay?
Yeah, yes. And Keisha, so does stress cause my diabetes levels to rise? Stress, we know stress is going rampant right now, so.
Yeah, so increased stress levels, they can cause your blood sugars to rise. So again, I was talking about sleep, and I was discussing a hormone called cortisol. When you have high levels of cortisol, which is a stress hormone in your body, it will cause your blood sugars to go up. So yes, being in a stressful situation, it can also cause us to not have our normal routine of exercise and what we're eating. And when we see people are more stressed, their blood sugars tend to be higher because they're not managing the stress well. And then in turn, they're not managing, their eating or their exercise well. And we see those numbers go up.
Yes. So thank you, Keisha. It seems like we do not have any more questions in the chat. And we do appreciate you as always. We thank you so much. Have a great day, everyone. We will give you back your day. And before I do leave, we do have another webinar on next Wednesday, the 10th of November, and that will be on Alzheimer's disease. So please join us. Thank you so much again. We appreciate all your time and your effort. Thank you, Keisha. We
Thank
do
you,
appreciate you.
Michelle.
Have a great day. Have a great day. Thank you.
You too.